Hello everyone, welcome back to Healthful Care. Today let's talk about stroke, the fast sign and other symptoms. What is a stroke? A stroke occurs when the blood supply to the brain is disrupted. In roughly 80% of cases, this disruption is due to a blood clot or a blocked artery. Strokes can also result from damage to the blood vessel itself. When the brain cells do not receive the necessary oxygen due to this diminished blood supply, they cease to function, and if this interruption persists, these brain cells may die. The severity of a stroke's effects depends on the duration of the blood supply interruption. A minor stroke, often called a transient ischemic attack, TIA, occurs when a blood vessel is temporarily blocked. The symptoms can resolve within minutes as blood flow is restored, and there might be minimal permanent brain cell damage. Nevertheless, a TIA can serve as a warning sign of a potentially more severe stroke, making it crucial to take it seriously and seek help, even if the symptoms dissipate on their own. Approximately 4 out of 10 individuals who experience a TIA will go on to have a full-blown stroke. A significant stroke can result in profound symptoms, including long-term complications due to brain cell damage. Without prompt assistance, a stroke can even be fatal. A quicker response to seeking help improves the chances of a successful recovery. Who is at risk? While strokes can affect anyone, certain individuals are at higher risk. You may not be aware of a weakened blood vessel that could rupture, but many risk factors for stroke can be identified and often mitigated. Most strokes are associated with blood clots or blockages in the blood vessels supplying the brain. Fortunately, many factors contributing to these types of blockages can be controlled. You may have a higher risk of experiencing a stroke if you are overweight, you smoke, you consume excessive amounts of alcohol, you have high cholesterol, your blood pressure is elevated, you have specific medical conditions, such as diabetes or atrial fibrillation. When does a stroke occur? Stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Utilize the FAST test to identify the most common stroke symptoms, whether in yourself or someone else. Face. Observe if one side of the face droops when smiling. Arms. Raise both arms and check if one arm drops down. Speech. Utter a brief phrase and assess for slurred or unusual speech. Time. If any of these signs are present, call 911 without delay and make a note of when the symptoms commenced. Time is of the essence when it comes to stroke treatment. Contacting a medical professional or attempting to transport yourself to the hospital can be time-consuming. Ambulance personnel can swiftly assess your condition, significantly improving your chances of receiving prompt treatment. Depending on the type of stroke, physicians may administer aspirin or potent clot-dissolving medications. The treatment is most effective when administered within 3 hours of symptom onset. In cases of stroke caused by a ruptured blood vessel, medical professionals will endeavor to halt the bleeding as soon as possible. Warning signs. Occasionally, a stroke may develop gradually, but most often, it manifests suddenly with symptoms such as numbness or weakness on one side of the face, arm, or leg. Confusion or difficulty understanding others, impaired speech. Vision problems in one or both eyes. Difficulty walking, maintaining balance, or coordination, dizziness, a sudden unexplained severe headache. If you experience any of these symptoms, it's imperative to dial 911, even if you're uncertain whether it's a stroke. Be prepared. Every year, more than 795,000 people in the United States have a stroke. About 610,000 of these are first or new strokes. About 185,000 strokes, nearly 1 in 4, are in people who have had a previous stroke. Being prepared for an emergency can make a significant difference. Familiarize yourself with the warning signs of a stroke and share this knowledge with your family and friends. Teach your children the FAST test, as well as how to call 911, provide your address, and describe the situation accurately. That's a wrap for this video. If you found it helpful, please give it a thumbs up and subscribe. Thank you.